Hello and greetings everyone, this is Mohanarangan from Dental Lifeline blogger. Now in pandemic, many of the dental clinics are currently closed and the people who are in the midst of treatment or in the beginning of treatment would be having a thought of finishing it as soon as possible. No other go, you have to wait till the condition becomes normal again. Apart from them, there are some people who are having so many doubts related to the arrangement and the condition of the teeth in their oral cavity, and they want to see a dentist and they want to clear their doubts. Especially the parents of a 3 to 6 year old child would be having so many doubts whether the teeth arrangement or the condition, is it fine or not, or we could treat it now or we could leave it as such. So now I am going to share a video in which I am going to tell some irregular arrangement of the teeth in 3 different stages of life, that is in a child's age, in an adolescent age and in an adult age. So if you have any kind of such problems or if your child is present with any kind of these arrangements, you can just consult a dentist at the earliest and you could treat it as soon as possible. First, we shall see the irregular arrangement seen in a child's age, that is in a primary dentition or in a milk teeth. We have 20 teeth in the oral cavity. So the first irregular arrangement that I'm going to say is about spaced dentition. Many people would be having a wrong assumption that the space that is seen between the teeth is looking so awkward and they want to treat it. And many people would be saying that my child has no space between the teeth and it looks so wonderful. But there's the problem. Spaced dentition is a must in a child's age because the primary teeth size is so less and the permanent teeth would accommodate and adjust in that space, so that in the future the permanent teeth would be having without any space. It will be lying without any space. So if your child has a non-spaced dentition, please do start the treatment at the earliest. The second irregular arrangement that I am going to talk about is due to the habits. Habits are various kinds in various children. So I am going to talk about 4 important habits that can lead to serious dental problems. The first dental habit that I am going to talk about is thumb sucking. Thumb sucking is placing the thumb in the oral cavity and placing the pressure onto the palate. This habit would be seen in children. Most of the children or almost all of the children would be having this habit predominantly. But it is allowed or okay up to 4 years of age. But if it exceeds beyond 4 years of age, it may cause crossbite predominantly. Crossbite is such that the mandibular arch is present outside and the maxillary or upper palatal arch is present inside, which is a very awkward condition. This is due to the pressure of the thumb on the palate and a narrowing of that arch due to this pressure. It may also cause forwardly placed incisors that it extends outward and it may come out of the lip and it may show as a rabbit teeth. The next condition which I am going to talk about is lip or nail biting. This condition should not be present in any of the children at any age. But if it is present, it may also cause the forwardly placed incisors and a much worse habit, that is a masochistic habit. Masochistic habit is known as self-injuring habit, that the child may bite the lip again and again and it may bleed as such. So if your child has an habit of biting a lip or a nail, please do make sure that he leaves that habit at the earliest. The next habit which I am going to talk about is tongue thrusting. Tongue thrusting is placing the tongue in between the dentition, between the upper and the lower teeth, or placing the pressure on the lingual side of the incisors or in the anterior teeth. So this condition may cause open bite and as well as it may cause speech problems in the child in the near future. If this occurs, the upper and lower teeth, even if they close, they may not come in contact with each other. So that's a serious problem, as well as there will be a speech problem. They can't say 16 as 16, they will say 15. The pronunciation of the words may differ. The next condition which I am going to talk about is mouth breathing. Mouth breathing habit may be due to two reasons. That is due to nasal problems or a habitual problem. Nasal problem, if they have an obstruction in the nose or they have a nasal polyp, they may have a problem in the nasal breathing. So they would obviously they would open their mouth and they would sleep. That may cause snoring also. But in a habitual problem, they voluntarily they want to breathe in the air with the mouth, so they open the mouth and they do that. So if they do that, it may also cause many problems such as open bite. So the nail or lip biting habit and mouth breathing habit should not be present at any age. So if your child has such kind of habit, please do make sure you correct it at the earliest. The next irregular arrangement which I am going to talk about is during the adolescent age. That is in the mixed dentition period. That is where the milk teeth and the permanent teeth are simultaneously present in the oral cavity. The first thing which I am going to tell about is the ugly duckling stage. So many parents would get afraid of the teeth arrangement. That is, the lateral incisor would become flared and they would say that it is so ugly looking and they want to correct it. Actually, it is a self-correcting problem. When the canines erupt in the oral cavity, they will not be erupting in the straight direction, they would be erupting in an inclined way. So they would cause a pressure on the lateral incisor roots, and this pressure would cause the inclination of the lateral incisors as well as the inclination of the central incisors. So you would see a flared anterior teeth in that period, and when the canines become straight and if they erupt, this anomaly would be self-corrected. So if you see this problem between the ages 9 to 11, you need not be afraid. But if it exceeds to some extent beyond the age of 11, you could just consult a dentist and treat this as soon as possible. The next problem which I am going to talk about is retained deciduous teeth. That is, the milk teeth would be retained in the oral cavity beyond a certain period. Actually, there is a chronological age which would be followed for every teeth. That is, at which period this teeth should erupt in the oral cavity and at what time this should shed and the permanent teeth should come to the place. So if the deciduous teeth, that is the milk teeth, is retained in that oral cavity for a long period of time, it may cause the permanent teeth to erupt in an abrupt direction or in a displaced way, and it may cause a serious problem in the near future. The next problem which I am going to talk about is the premature exfoliation of the primary teeth. That is, the milk teeth would shed before the period it should shed. Actually, if it sheds like that, many people would be so reluctant and so ignorant that what can be done. But we should know the information that the teeth has the tendency to move in a forward direction, that is in a mesial direction when there is a space available. So if the teeth sheds early and if the teeth moves mesially, the permanent teeth which is present under would not have any space to come up, and if that occurs, it would cause a displaced direction of eruption or an ectopic eruption, or it may erupt in a buccally or in lingual or in any kind of direction, or it may not erupt also. So this causes a serious problem. The next thing which I am going to say is about the orthodontic treatment that can be done in this age. Actually, the best period to do the orthodontic treatment is in this period, that is between the age 10 to 16 for both boys and girls. So if you have any kind of problem, please do the treatment now itself, because in this mixed dentition stage, it will be in a growing period. So in the growth period, any treatment would be successfully adapted to the oral cavity, or else in the future many problems can occur, or you should go to a new treatment or in an advanced treatment or in a surgical aspect of treatment if you just go into the adult stage. So please begin any treatment at this time of age so that you would get a better result than you get in the adult age. Next, we would move upon the irregular arrangement of the teeth in the permanent dentition stage, that is in the adult stage where the permanent teeth only is present in the oral cavity. So the first problem or the irregular arrangement which I am going to talk about is the space dentition. As I said earlier, space is required for primary dentition and space is not required for permanent dentition. If you have such kind of problem, please do consult a dentist and start the treatment as soon as possible. The next irregular arrangement we are going to talk about is the proclined incisors or the forwardly placed anteriors. So as I said earlier, it would be placed more forward, it may extend outward or it may go beyond the lip closure and it looks so awkward. So please do correct it as soon as possible if you have this problem. The next problem or the irregular arrangement which I am going to talk about is the crowding of teeth. Crowding of teeth is that due to non-adequate space in the anterior area, mostly the anteriors, they would be placed one above the other. This is of serious problem and many of us would be having mild to severe crowding. So if you have a severe crowding, please do correct it as soon as possible. The next irregular arrangement which I am going to talk about is the crossbite. As I said earlier, crossbite is such that the mandibular arch would be present outward and due to the non-adequate expansion of the maxilla or upper palate, the maxillary arch teeth would be present inward and that is also a serious problem. The next irregular arrangement which I am going to talk about is the inclination of the teeth. That is, the alignment would be proper but the inclination of individual teeth would be not proper. They may be placed more buccally or more lingually. So if you have any such problem, you can just correct it. Another problem is that supernumerary teeth, we would say, that is extra teeth that is erupting in the oral cavity. If it is not giving any such hindrance or any such problem, you can just have it, or if you feel that it is not required, you can just treat it or just remove it from the oral cavity. Last but not least, I would just say one problem, that is many children would be having a habit of bringing their mandible voluntarily forward and keeping it beyond the maxillary teeth or beyond the upper palate. So if they keep it as such, it may develop into a serious problem in the near future. We call it as class 3 malocclusion, where the mandibular teeth is placed forward to the maxillary teeth. So these problems should be avoided and you can find it at home without consulting a dentist at this point of pandemic period. So that's it for today. Hope you guys like this video. Give your comments in the comment section and give your suggestions about the future topics also. So have a nice day. Take care. Bye.